So good afternoon. Afternoon, we have taken lunch. Why are you not happy? You should smile. I can see Dr. Kakobe has not eaten, but he's still smiling. So those who came earlier can still afford a smile. Thank you very much. My name is Onesmus Kamau. I am the head of digital health in the Ministry of Health, and I'm very glad to be here this afternoon to join these experts and able team from various organizations and institutions to discuss this issue of mutual interest to all of us. In my other life, I also do some medical law. So I am so much passionate about health informatics and also about issues about the legal issues within the informatics. And when I see the discussions around the room, I get a lot of, passion in my heart because I know that we are really in the right path and we are also able to take care of our patients. I actually got a lot of interest from what was coming from the radiotherapy, and I think even things like the telemedicine that we've been talking about, I think we have a lot that can be able to discuss. And probably maybe see how maybe through the bank some of the projects that focuses on telemedicine can actually be included as part of the financing. I know that Kenya Health Federation would be very happy to see how we can be able to actually improve the area of consultations. It's an area that we have really been grappling with in terms of trying to get the experts, but I think we have not been able to get enough expertise, and I think working with this kind of an arrangement where the bank is able to finance some of the infrastructures, I think that would be a very good thing for us to think through so that we can be able to improve the coverage, the reach, and also improve the quality of care. Generally, I would like to make my comments about what has been presented, and I think what I would like to say is that looking at the market intelligence reports, we see that they are very helpful in understanding the numerous innovations that exist. And I think what we've been able to see here actually tells us that a lot of innovations, untapped potential exists within the country, but we have not been able to make use of it. So I really feel like if we can be able to really have this kind of discussions where we can be able to actually bring out some of these good innovations, then I think as a country will be a better place to make sure that we can be able to run how we can be able to benefit from the same. I'm hearing about the financing for the first time, so really I'm not maybe the first person or the last person to hear this. I hope that this will be a good take home for other people who are also in the room. And I think refreshing to see that the space has continued to grow, and Kenya is the second biggest hub for companies innovating in the area of supply chain. And I think the focus on health distribution, that's a very important area because we have been able to see that one of the challenges that we face in the country in terms of the health products is how to get them on time and how they should be able to reach the last person, that is a user. And I think using the technology that you have seen today, I see a lot of potential for us to do that. And I think the potential that Kenya's innovators have, it's also good to hear that most companies also serve the rural areas, which is the most underserved area in Kenya. Even with the county system, we still see a lot of gaps in terms of access, the quality of care at the rural areas, that I think investing more to make sure that the rural areas can also be able to benefit is an area that we really need to partner so that we can be able to make this a reality. And I think overall technology in the health sector is actually coming at a pace that we have to work and learn with it. If previously we used to see very minimal investments, we didn't see a lot of investment in terms of digital technologies, but today anywhere that you're going, you go to the counties, you find a lot of investment. So we really need to see how we can be able to work with the counties, with the national government, and other players within the sector so that we can be able to see how this technology can work for us. In terms of the regulatory insight, I think we have seen so much about the online pharmacy, and I think for those who have been there working with us, sometimes back we came up with the standards for Kenya mHealth standards and guidelines. If you look at those guidelines, you see that one of the areas that we are trying to address is the issue of online pharmacies. There's a lot of online virtual engagement. You have seen quite a number of innovations. I don't want to mention some of them, but I think all of us know about MyDawa. It's a brilliant innovation that brought us to where we are, and people are able to access quality medical care because we are able to get quality medicines from the manufacturers directly to the consumer through the retail outlets within the estate. So you can be able to really work to see that our clients can be able to benefit from quality medicine, the whole journey from pharmacovigilance. I think that's an important area that we need to work on so that we can be able to see how the health sector can be able to evolve. And I think for those who are also in the space, we'd also learn that besides this, we have also been trying to come up with many other innovations. Today, as you're talking, we have been trying to see how we can be able to come up with a digital platform that can be able to help us in terms of standardizing how technology is used in the healthcare. You see that we are trying to see, instead of having those many multiple systems, can we be able to come up with one multiple system that can be able to, that is interoperable with other systems, so that when you innovate, you're also able to actually to plug your system to another existing systems. And that actually completes the entire journey in terms of ensuring that the clients can, that continuum of care the patient is looking for, from point X to point Y, from counter X to counter Y, can actually be able to access it. And that's what is missing, because today portability of medical records is a challenge. People walk from one counter to the other. When you go to the counter, you're told, okay, can you give us your records? You have nothing. So portability is an important area, and I believe that if you can be able to make this technology work for us, I think you'll be able to make our work easier and also improve the lives of our clients. And I think for me, what I would like to say is that there's a lot of work that we need to do in terms of public-private partnerships. We need to make sure that we are able to engage with each other across board, so that we can be able to learn from each other, support each other, and also make sure that we don't also renovate what has already been done. Try to see how, through the partnership, the build, operate, and transfer policy is a good thing. Try to see how you can be able to come up with something. If it works for you, don't keep it for yourself forever. If you want to really help, work on it for the number of years, give it back, and that also helps us in terms of realizing the universal health coverage, which is one of the core mandates of our ministry, and that's one of the big four agenda of this government of Kenya. And I think the advocacy is important, and we also want to see how we can be able to amplify some of the good lessons that we have been able to learn from the process, to make sure that what is working in the private sector can also work in the public. A very good case is we have been working with the Kenya Health Federation to ensure that we actually implement what we call automated indicator reporting. That a health facility does not really need to send us those pieces of paper. You can actually be able to actually automate your systems, so that the national system, because it's actually mandatory for you to report, can actually be able to receive your report every month. We don't necessarily have to carry all those papers. That also saves on our economy, because we're also using less. And it also saves on cost as a provider. So really, mine is to thank you for this great meeting, and also to reiterate that our doors are open. We want to work with everyone, and I think you also be able to work far with you and your support. And I think those good projects that I'm hearing here can also find our way in Afya House, so that we can also be able to work together. Thank you, and God bless you.